Hi, I'm Dr. Rudy Cashman, neurosurgeon for Wayne, Indiana, 41 years, but I'm only 39. No. Today is a continuing series of talks that we're having about the effects of the mind on the body. And today I have a very interesting subject, mindfulness for pain and stress. And I have a wonderful guest with us this evening, Dr. David Johnson, professor of nursing at St. Francis University for about 20 years, an expert really in psychology and the human mind. And good evening, Dr. Johnson. So glad to have you here with us tonight. And Dr. Johnson, what is a good definition of stress, especially with the holidays coming, and we're all stressed?
Yeah, we are. And, you know, I really like Dr. Hans Selye's definition, stress being a non-specific response to any demand or change. And so when we think in terms of non-specific, he was really referring to that it's really coming at us from multiple angles. It's not just a body's response or a mind's response or a spirit's response, but it's non-specific to any demand. We've all experienced demands and change. So even positive change can elicit that stress response system. Very
interesting. Hans Selye, the famous doctor from Toronto, Montreal, published many papers on stress, probably almost thousands of papers, very interesting. I have my own definition also, inability to deal with perceived or real threats to our spiritual, physical, social well-being.
Yes.
But Hans Selye's definition, though, clearly is the best, an unspecific response of the body. We all have stress in our lives, don't we? Even the best of times.
Yes, yes. You know, that alarm clock is what gets you up in the morning. And our work is stressful. And there's a delicate balance of being charged and creative and enthused with our lives, and keeping those multiple balls juggling in the air. We feel a sense of success with stress. We get a little bit apathetic. We get a little bit stagnant if we don't have some good stirring going on in our lives. But too much stirring spoils the pot, so to speak. Too much stress, and we feel overwhelmed, and we experience other kinds of illnesses.
Thank you. I mean, how we think really is everything, isn't it? I mean, begin the day with music. Turn the music on.
Yes.
Think happy thoughts.
Yes.
Is really what we're talking about. Tell me, Dr. Johnson, what's the difference between acute and chronic long-term stress?
Yeah. Acute being in the moment, now, short-term. Something's happened. I just got locked out of my car. I have a flat tire. I got rear-ended. I'm on my way to work, and I've got a presentation. I've got to do a television interview with Dr. Cashman. That's acute. That's acute stress. Chronic stress are those things that are not easily resolved, that are going to last a little bit longer. And so a death of a loved one, I mean, a death of a spouse, a death of a relationship, divorce, death of a job, so to speak. I see a lot of people in my counseling practice who are experiencing layoffs or downsizings or right-sizings or re-engineerings. Every day I look into the eyes of hopelessness when people are not able to find employment. Those are more chronic stress in the sense of they're not easily resolved.
Thank you. Stress is really the cause of a lot of illnesses, isn't it?
Yes.
Irritable bowel, headaches. And tell us something about the effects of the human mind in a stressful condition on the body and the illnesses that it causes.
Sure. When that stress system is activated, I liken it to that fight or flight mechanism that takes place in the brain. It's a primitive mechanism. It's a necessary mechanism. It works, and it works very well when we need it. The dog runs out in front of your car on the way to work this morning, and you have a little bit of cortisol released, a little bit of stress hormone. Your pupils dilate, your heart beats faster, you take a little, a few extra breaths, but in a nanosecond, you hit that brake, and you hit it hard, and you hit it fast. You don't have to think. It's on autopilot. That's good stress. But the unfortunate thing is that we have difficulty turning it off. And so later, you get to work, and you're at the coffee pot, and you're sharing a cup of coffee with friends or coworkers, and you're telling that story. And you get another jolt, so to speak, because your nervous system is continuing to respond to that story, those images that were imprinted in your brain when the dog ran out in front of your car.
In other words, chronic stress is reflected in your brain. It gets stored in your brain, doesn't it?
It does.
And the effects of it can last for months or years.
Yes.
Or you've had some trauma as a child.
Yes.
Perhaps from the family, and 20, 30 years later, you still have fibromyalgia reacting to that stored stress throughout our lives.
Let me say a little bit about that, because the reality is that stored stress, I'm seeing a lot of folks today in clinical practice that have experienced those kind of life-changing events. Right now, we're seeing people come home from war. And you can only imagine the pictures that are stored in their amygdala, that part of their brain where they're storing those memories and those stories. And so they reactivate. So there's post-traumatic. I'm going back over those pictures over and over again. I'm part of a critical incident stress debriefing team. I work with fire, I work with ambulance, I work with police, nurses, doctors who have been traumatized sometimes by their work. They see things that other human beings don't see. They are outside the ordinary. They go home, and those pictures of horror still in their brain. Keeps them from going to sleep at night. It keeps them from having meaningful relationships. So it impacts them. It impacts them in a very physical as well as mental way.
Thank you. Matter of fact, to show you how irrelevant this is, it was just a few days ago that at the hospital, there was a gentleman who'd been in the war, attempted suicide.
Yes.
And a very serious thing to happen from chronic stress. The second subject we'll be discussing today is chronic pain, long-term pain. What's chronic pain? It's pain that lasts more than 6 months. Acute pain would be a broken leg or something of that nature. We give it some pills. We put a cast on there. A month later, it's healed. We have no pain, and the situation is over. Chronic stress, in my experience of 41 years as a neurosurgeon, chronic pain is something altogether different. What I see today a great deal is these patients are treated with narcotics, with too many injections, sometimes even surgery. From my experience as a neurosurgeon, to tell you a little bit about it, we divide chronic stress, long-term stress, into neuropathic pain. That's some nerve injury, like an amputated leg, shark bit your leg off, or you had an accident, or trigeminal neuralgia, or ruptured disc. That's only 10% of pain problems. So then we have another 10% of pain problems. It was called nociceptive pain. That'd be like arthritis, tennis elbow, bursitis. You don't need narcotics for that. You treat the condition, put some ice on it, and you get better. But then we have, in chronic pain, the 50% who come in to see us, Dr. Johnson, they say, I hurt, but we don't know why they hurt. Some of the literature would call it idiopathic pain, but who likes to be called an idiot or pathetic? So I don't like the term. Unknown pain, patients don't want to hear that. They experience a pain. It is real. Yes. It is real. But you run all sorts of tests, you don't find the answers. So I formed an alt term myself, and I kind of wondered how you felt about this. I thought I'd just call it metabolic pain. A little friendlier term. We know what we're talking about. We admit that it's real, but we don't know the real cause of it. Yes. And in my experience, I see so many patients treated with narcotics and procedures, which really, in the long run, makes them worse. Yes. And that's why I like your approach of what you teach at the Cashman Mind Body Institute, mindfulness teaching for chronic pain problems. It has no complications, no injections, and I'd like you to explain to the audience what is mindfulness teaching for stress and chronic pain?
Sure, sure, sure. Well, let's talk about the big umbrella, first of all, of meditation. There's lots of different ways to meditate, and mindfulness is just one particular approach to meditation. But it's a very useful approach because it gives us a place to start. And so the miracle of mindfulness, Thich Nhat Hanh, the Vietnamese activist who called it a miracle, is that when we practice this form of meditation, it creates a sense of equanimity, a balance of mind in light of the tsunamis that come after us in our lives. And pain is a tsunami. When we're experiencing pain, whether it be physical, emotional, spiritual pain, we are overwhelmed. We feel like we're gasping for our lives. And the notion of mindfulness then becomes a restorative practice, a place where we can stop, pause. I call it the power of pause, where we can stop and be able to breathe. All of our spiritual traditions, many of our spiritual traditions, start with the slow, deep breath. We're breathing. We know we're breathing. But when we stop and become more deliberate in our breathing, we begin to turn on, as you know, Doctor, the parasympathetic nervous system, the restorative side, where we begin to relax. And of course, with pain, it begins to alter, in many cases, the perception of that pain. That's what we're really after in terms of helping people to create a sense of balance, a sense of equanimity in light of their pain. Because if they don't, the musculoskeletal system is going to be responding to the pain. It tightens around the pain source, exacerbating or causing more pain. So mindfulness is a practice whereby we're able to help people shift ever so slightly into a different mode where they begin to experience a more peaceful, a more relaxed, and more adaptive. They're able to cope with their pain, and in some instances actually have less, or the pain actually goes away.
A very nice explanation. So mindfulness really is to get you to look at the pain itself, to appreciate the pain by itself, by putting you in a meditative state,
yes,
and to avoid bringing your reaction to it into the picture.
That's exactly right.
Which cuts way down on the pain. So you see the pain in its purity.
Yes.
In its purity, and you reduce your reactivity.
Yes.
You know, it's very interesting. I was reading a book the other day, and one of the chapters was the two arrows, a Buddhist way of looking at it, and I would like to know your response to this. The first arrow would be the broken leg, for example. That you have the painful condition, you treat it, you put a cast on it, you give some medication. In a month, it's over. That's the first arrow.
Yes.
But now let's talk about the second arrow. What's the second arrow? The second arrow is your reaction, just what you're talking about, to try to get rid of this reaction to the pure pain, which may not be that bad. It's about your reaction that's bad. So the first arrow could be a fairly small arrow, maybe very painful, but you don't overdo it. You don't get addicted to narcotics, the arrow is small. But to me, in my experience, arrow number 2, huge. Huge.
Yes.
Your emotional reaction to it, your hopelessness, your anxiety, your anger. And if it's fed, in my experience, if arrow 2 is fed by narcotics, that causes sensitization of the body, and your pain sensitivity increases. I see pain patients, they're so sensitive, you can't touch their skin. It's because they've been taking narcotics for so long. That's part of the reason, we did this program, because we see patients going to pain centers and they're giving all these narcotics, the skin is being sensitized, and things are not getting better, they're getting worse. You won't believe this, Dr. Johnson. They have shown in pain research that even for neuropathic pain, nerve injury pain, that narcotics only work in 30% of the patients, 30% of the time. So why do you give them in the first place, even with this nerve injury? So narcotics are not a good thing for chronic pain problems. You know what's a good thing? Mindfulness teaching. The course you teach is the answer, I think, for chronic stress and for chronic pain. I think this arrow theory, arrow 1, arrow 2, I think a nice way to explain chronic pain, isn't it, Dr. Johnson?
I do too. I think so. It's first I'm hearing you talk about the arrows, and I really like the metaphor because the reality is when we first encounter pain, obviously, whatever we can do to put the body in a healing response is going to be helpful. That second arrow, when the body isn't healing or our perception that body isn't healing and pain still continues, people panic. People have extreme anxiety. The musculoskeletal system is the first to respond to that stress and that anxiety, henceforth creating, I would think, a very circular pattern. If pain source, if muscles are squeezing around pain sources, you have more pain, not less pain. So being able to break that second arrow, I think, is a helpful phenomena.
I think you explained really fibromyalgia, which is due to muscle tension and stress, and it's really an extension of the mind and the metabolic pain. I mean, which I was speaking about, the metabolic pain being to hopelessness and anger and depression, anxiety. I see patients like this in the emergency room very commonly. They come in there with their overwhelming craving for a narcotic medication. They need dopamine. They need to feel better, which is really the problem. It's a problem of the chemistry of the mind. I mean, the pain really is real. Dr. Johnson, how does the mind speak to the body?
Yes.
Can the body speak also to the mind?
Yes.
What are your thoughts on that?
Yeah. Well, first of all, that neurotransmitters that we're talking about, the stress response, when it's activated, when that dog runs out in front of the car and we have that stress response, we need it. I mean, it's a primitive response, but we need it. If we're being chased by a bear in the woods, we want that stress response. It's a way for us to be able to survive. It's a survival mechanism. So our perception of the world, our perception about what is happening is what gives us the ability to survive. Pupils dilate, heart increases rate. Our perception stimulates the fight or flight mechanism. That's how the nervous system then is talking to the body. It shuts down or it slows down metabolism. It increases the heart rate. It increases so the nervous system is talking to the body. It's innervating the body. It's helping us initially, if indeed we're trying to run from the bear in the woods. But as you know, stress isn't always about something that's really happening. It's taking place in our mind, our thinking about the past, our thinking about the future. We're stirring old memories, old stories that are stressful. And so we're here right now. We're here right now. But our brains can be somewhere else. And if that place that we go to in our brain is stressful, your body's going to be secreting those same stress hormones. If we bathe our brains and our bodies with excess chemicals, that's when the body begins to break down. That's when the brain begins to break down. And that's why we try to do the opposite. We try to stimulate the parasympathetic nervous system so that we can begin to have a restorative feature that can combat that stress response.
The mindfulness teaching then really brings out the relaxation reflex that Dr. Herb Benson speaks about, the acetylcholine that relaxes us, and these neurotransmitters and hormones that we were speaking about that are secreted by stress can affect the organs of our body. That's the reason we have irritable bowel and atypical chest pain and skin rashes and abdominal pain and bladder pain. Irritable bowel, probably 20 million people. Fibromyalgia, probably 30 million people. And that's why mindfulness would help treat this condition. And what's kind of interesting, having been in this business 41 years, I'd say 75% of the patients that go see a doctor, Dr. Johnson, you would not believe it, 75% of the people come to see us have a mind-body illness. They have a physical presentation of stress, and all they really need is mindfulness teaching, no prescription, no injection, and no operation. Many of those patients, in my experience, Dr. Johnson, is that they have been what I call nocebo, the opposite of placebo. Placebo means to heal. It could be a pill. It could be us. Nocebo will be negative talk with their diagnostic studies. They'll get an MRI or CT and say, well, you have degenerative disc disease, your neck pain and headaches is due to this on the MRI, when in reality, it's the tight muscles from the chronic stress response, which you were speaking about. These illnesses are extremely common. Wouldn't mindfulness teaching be the best way to treat mind-body illnesses?
Mindfulness is a wonderful mechanism for the reasons that you were talking about in terms of no side effects. Certainly helps to position the body to heal. That's what we're after. We're after healing. And so when you help people come to their senses, this notion of how do we come to our senses in this moment, not being hijacked somewhere in our brain to the past or to the future, but coming into a present moment. Sounds really cliche. In fact, Herb Benson, I contend, and maybe you can agree or disagree with this, I don't know. I think that Dr. Benson actually was very wise by calling it the relaxation response, because initially, I think Westerners were frightened by this notion of meditation, that somehow people would lose control of their mind, that somehow they were going to be somewhere else. But actually, it's the opposite. We're calling people to their senses. We're calling them to be in a present moment. And we tell people how to do that. Start with the breath. Inhale through the nose, exhale through pursed lips. It takes them off of automatic breathing into a controlled type of breathing. Then focus on their senses. What are they seeing? What are they seeing in the real time? What are they hearing in real time? As soon as I'm out on a walk, if I'm walking and I'm doing mindfulness meditation in my walk or my run, and I say, what am I hearing? I hear the birds. I hear cars. I hear a train whistle. I hear my feet running through the leaves. I turn on to the moment. I turn into the now, which is taking place, which is very much restorative, versus if I'm going someplace stressful in my brain, to the past or to the future. So mindfulness means a calling of one's attention to a present moment.
Not to think of the tsunami of the past or the thunderstorm or the future.
Yes.
Just what's going on right now.
Right now.
That's mindfulness.
That is.
It's a lot less painful.
Yes.
It's a lot less stressful. I mean, isn't mindful teaching really safer than injections, medications, and operations? I mean, it really has no complications.
There are no complications with it. There are no complications with it. And I think just the opposite is true, in the sense of people feel more in control. Even if, worst case scenario, the pain doesn't get better. The reality is, can a person come to have a stability of mind to be able to make good decisions about their pain management strategies? Because indeed, if we're panicked or we're on autopilot with our stress, we might choose to hop from one physician to another, to another, to another, to one nurse practitioner, to one other healthcare provider, as opposed to jumping in the saddle of our own chronic condition and being able to problem solve more effectively. So at worst case scenario, we help position the person to have 100% of their marbles, 100% of their ability to problem solve. Isn't that what we're all after? Getting people to make their own decisions and problem solve, and come to and come to a realization about what this pain really means. And you've already alluded to this. Sometimes the pain is centered other places. It could be that it's connected to somehow a psychological need. Something's missing in their life, or something's, a relationship that has gone bad, or a lack of forgiveness, or an old grudge, an old hurt, an old discomfort. It all impacts our pain sensors and our sensibility in terms of how to cope with it.
Thank you, Dr. Johnson. That's really what I look at every day in the office, is that the psychology of the pain from hopelessness or anger, their past, is really complicating the whole matter. If they will really sit down and look at where they think the pain is, which many times, as I mentioned, can't be demonstrated. It's metabolic pain. Mm-hmm. It's the chemistry of their brain. And they want a quick fix, something done right away, an injection or an operation, which is not going to solve the problem. What is your opinion on prescription drugs as being the biggest cause of drug addiction in our city? I see it in the newspaper. I've experienced it. Frankly, it's across the whole country. You know, many famous movie stars have died from prescriptions. And I'm totally convinced, and I think the community is also, biggest cause of drug addiction in the nation is prescriptions.
Well, what we know is that nobody starts out to wanting to be an addict. You and I both have treated or have come into contact with both nurses and physicians and other healthcare providers, as well as non-providers who have gotten addicted to drugs. None of us, I don't think any of us ever say, I'm going to my doctor to become addicted. It's an insidious, it's a slow process. We get a narcotic, we get a pain injection because our pain is real. Oftentimes, it starts with something that we've been injured on the job, we've had a back injury, we've experienced something, and we've gotten addicted to that particular prescription medication. I think it's a huge issue. I think, of course, addiction in general is huge, not only from pain medication, but from alcoholism. We can stretch that little concept big, in terms of the overuse of other substances to try to sedate or anesthetize, whether it be psychological or physical pain. People hurt, and when they hurt, they'll do almost anything to relieve that discomfort. And so I'm concerned sometimes with, when we talk about addiction, somehow it feels like those of us in the treating business are pointing fingers. But the reality is, it's not a weak moral character. It's not, that we started down a path because we wanted to become an addict. We've started down a path because we were wanting relief. And so for me, helping people to see that they have other options besides narcotics. Talk therapy is used as an adjunct for pain management. I would hope that any person prescribing a narcotic would also be prescribing a meditation program, a yoga, a Tai Chi, physical therapy, talk therapy, something that goes in addition to the narcotic. Would you agree to that?
Oh, absolutely. And when I read pain books, for example, or experience the patients, seeing the patients, is that the holistic methods of treatment, which we're talking about, which you're doing, is not recommended very often, unfortunately. Yeah. That's why we're doing this program. A lot of patients with chronic pain problems, they have blocking, and they'll substitute alcohol, cigarettes, and alcohol, it turned out, is the biggest poison that we can drink. It's even a bigger problem than narcotics. I was reading the paper again the other day. They'll substitute things.
Yes.
And if that doesn't work, then they become overwhelmed with the whole project. Think of suicide or quitting their job or getting a divorce or doing other silly things which are not going to help their chronic pain problem. As a method of treatment, Dr. Johnson, what is a body scan? I read about a body scan and mindfulness teaching that Kabat-Zinn uses at Harvard, an effective way to deal with stress and pain. Could you describe that to us?
Sure, sure. When we're talking about the body scan, first of all, we're not talking about an MRI or
That's a good point.
or an expensive.
That's great. I
Yeah,
thought of that. Yeah.
What we're talking about from a scan perspective is that I'm going to mindfully think about every muscle in my body slowly and deliberately. I'm going to begin to scan, and you can start at the top of your head or you can start at your toes. But I recommend that you start somewhere at the top or the bottom, and you focus. You focus, because that musculoskeletal system is the first to respond to stress. And so when you're scanning, you're looking for signs where you're holding tension or excess energy within that musculoskeletal system. And so you're consciously saying, I'm focusing on my toes. Is there tension within my foot? And sometimes we can create a little bit of tension and then feel the opposite of relaxation. With fibromyalgia, we choose not to tense any of the muscles. We're just scanning the muscles because we don't want to elicit any type of pain response. So scanning, we're just thinking about the toes, the lower legs, the upper legs, the buttocks, the back. We're scanning, we're moving up, and with each muscle group, we're gradually asking ourselves, we're going from amygdala to prefrontal cortex. We're the prefrontal cortex to be able to have an examination, a second peek, a second pause in terms of where we're holding tension within that body, and then consciously allowing that tension to flow away from the body. If a lot of times with my clients or patients, I'll have them bend back at the right wrist, and I'll say, take the left wrist or the left hand and just touch the arm on the anterior or the posterior surface, and we can touch it. And if I touch it, I can feel the tension within that body, and then I can feel the opposite. I can do the opposite. So the body scan becomes a way for us, first of all, to recognize where we're holding tension within the body, and then we're allowing that tension to flow away from the body or the pain source.
Thank you. And most of the time that starts with sort of a meditative state, doesn't it? Maybe some deep breathing or something. Then we use our visualization of our own body to get the pain out of the body, or maybe to even visualize getting cancer out of the body. These are really visualization and mind techniques that work. I've seen them work.
Yeah, and actually, you know, I'm glad you kind of brought up visualization, because visualization is actually a different kind of meditation, and it works, and I teach that in the mindfulness-based practice as well. But visualization actually is visualizing the body in an ideal type of way, in a more relaxed type of way. That serves as you know, the nervous system is going to respond to pictures. So if I'm picturing, if I'm having pictures and old memories of pain, my body's going to respond to that. Whereas if I image myself in the Bahamas, my nervous system thinks that I'm in the Bahamas. And so it begins to kick back and it begins to relax. But the core of mindfulness doesn't really utilize, it focuses more on the here and the now, the realness that's taking place within our body, utilizing all of our senses, and not just our hearing, our tasting, our touching, our feeling kind of senses, but actually interoception, the notion of organ within. Can we feel tension within the body? You know, can I feel when I'm hungry? Isn't that interesting? Because in our society, we typically eat or overeat, as you know. And so we teach mindfulness in terms of a way of eating. In the mindfulness class, we spend maybe 5 to 7 minutes on eating one raisin. I know that sounds crazy, but we examine the raisin. We put the raisin and we look at the raisin, and we roll it around, and we listen, and we smell it, and then we taste it. We notice. We become aware of how the tongue knows how to receive the raisin and how to put it into the mouth. automatically, and we pay attention to that. So mindfulness can be a way of just calling attention to whatever sense that we're experiencing, and it's certainly eating is a big piece of that as well. So the concept of the body scan and also the concept of being aware of introception, the feeling within, proprioception, balance, moving through time and space, having that sense of awareness. Yes, earlier last week when I was running, I always, at least 15 minutes of my run, turn off my iPod, become acutely aware of the setting, and I noticed that when I was running that my legs took me. But what was on autopilot, running, I could feel my legs moving through time and space.
That's really meditation, isn't it?
It is.
It is. Paying attention is a meditation.
It is. It's very meditative.
Frankly, I speak to the flowers. I speak to the birds.
There you go.
That's really meditation, isn't it?
It
Into
is.
the very present moment, and that's very relaxing.
It is very relaxing.
We all need to do much more of that. What is diaphragmatic breathing? You hear about meditation and diaphragmatic breathing. What's that, Dr. Johnson?
Yeah, we have a dome-shaped muscle, obviously, that separates our chest from our abdomen. And when we diaphragmatically breathe, we're actually increasing the amount of oxygen that's being able to be taken in the lower third of our lungs. Because we stress breathe, many of us in adulthood will only utilize the upper 2/3 of our lungs. And so when we encourage people to practice diaphragmatic breathing, we actually have them place their hands on their abdomen, and as they breathe, push down and out on the diaphragm, which increases, it's the belly breath is what it is. It's increasing the amount of taking some air into the lower third of the lungs and then bringing the air up into the upper 2/3 of the lungs. When we do that, we increase the amount of oxygen that's being absorbed. If we have more oxygen that's being absorbed, the heart doesn't have to beat as fast, the blood pressure doesn't have to be as high. If I hook somebody up to a pulse oximeter, a little machine that measures the PO2 or the percent of oxygen in their blood, I can see that with 2 slow deep breaths, 2 slow diaphragmatic breaths, that I increase the amount of the PO2 in their body. I immediately begin to see a shifting in their blood pressure and a shifting in their pulse. So it's very restorative once again, goes back to that parasympathetic nervous system. Just teaching people to breathe, being aware of their breath, slowing down the breath, taking in a diaphragmatic breath, increasing the amount in the lower third of the lungs can be very healing.
That's how babies breathe, don't they? I mean, you want to see diaphragmatic, relaxed belly breathing, just watch a baby.
Yes.
Because normally we pull it up, and we need to relax and pull it down. Tell me something. How do you motivate someone to wellness? How do you motivate a person to change their way they're treating their pain problem or their terrible stress problem? Do you have any techniques that you try to teach the people?
You mean besides telling them to read your book? Well,
I never thought you'd bring it up.
Well, one of the things is that, as you know, I think people are well-intentioned. Obese individuals. I don't think any of us start out wanting to be obese. I know for myself, the process of being too heavy is a slow process. And, if you gained a pound or 2 per year over the last 20 years, then you're 40, 50 pounds overweight. And so the motivation, most of us say we're motivated, but we lose focus. We lose focus. And so one of the tips that you talk about in your book that I hope to promote is the notion of mindfulness and utilizing the tool of journaling, the ability to write, because we have these insights about what would be helpful in becoming more well, whether we're talking about losing weight or starting a fitness program or starting a meditative practice, returning to church, increasing our connectedness with other past or friends. Those are all very helpful. Forgiving, letting go of past transgressions. So the journaling as a way of motivating, a secret, so to speak, is the ability to write not what's only in your brain or in your heart, but as you write it, you can see it. If you see it and say it and hear it, it becomes multi-sensory for kind of sorting through what's taking place in our lives. And it's motivating to us because then we can go back and we can revisit it. It's not just the tail end of a dream where we have some insights. It's concrete, it's real. So the journal, the notion of accountability partners. I think in your 12-week healthy eating program, I went through it a year and a half ago and lost 36 pounds. So I'm out there, I'm advocating for you. It's accountability. It's the ability to, it's the accountability of being able to weigh in and look at other people and high-five each other. And celebrate our successes. That's motivating. We know it takes 8 to 12 weeks to change a behavior. I don't think it's by accident that you have a 12-week program. I think the 12-week program is helpful in getting people committed to a lifestyle change. I think that that's critical.
Thank you, Dr. Johnson. What's the difference between responding to pain and stress instead of reacting to it?
Yes. Well, the reaction could be an autopilot. It's an automatic system whereby I'm experiencing pain, I become anxious, I become angry, I become frustrated, I stir more stress chemical within the body. I'm reacting to it. The notion of being able to assess that pain, to be mindful of that pain, to stop, to breathe, to relax, to not activate more pain centers. In our mindfulness-based practices, we take notice. We take a non-judgmental, compassionate, self-compassion is huge here. Not to beat ourselves up, to be able to look at it, to take the watcher's viewpoint, to see the pain at a bit of a distance, and to stir curiosity. Isn't it interesting? I had more pain today. I had less pain today. I had less pain today. Well, what is that connected to? Oh, I did some other self-care things. That's important to note. And so when we start becoming more aware or more attentive to or more mindful of what's working and not working, we feel more in control.
That's a great explanation. How do you what does being in your body mean?
Being in your body. You and I are here. We're here, right? Okay. But I can also be thinking about 7:30 having dinner with my wife, right? And I think she's going to make pork chops tonight. And if I start thinking about that, I'm going to salivate, right? Yeah. I'm gonna be. You and I are here.
Be sure to invite me.
but my brain's somewhere else. Well, if that's a happy space, I'm not releasing stress chemicals at that moment. But if it's not a happy space, make no mistake, I can be producing stress chemicals that are damaging to the body. So just having that awareness that I'm choosing to be here with you right now. Yes, I will have dinner with my wife later tonight, but the reality is being in my body means being here. When I'm with my granddaughter, I have 2 beautiful granddaughters. And so when I look at them, if I look into their eyes, I stop. I tell people that are learning mindfulness, grandparents in particular, stop and smell the kid, pre-adolescent. But stop and smell them. When I look into my granddaughter's eyes, Madison or Lola, and I say, I'm looking at them, and they say to me, Poppy, I see you.
Oh,
yes.
Beautiful.
Okay.
Beautiful.
Yeah. I know I'm with them, right? I'm in my body. I'm not somewhere else. I'm not distracted. I'm not being jolted by my Palm Pilot or my iPhone. I'm not tethered to my email. I'm not thinking about the report that I did or didn't do, that I should have done. I'm there. I'm looking into the eyes of my granddaughters, or I'm looking into the eyes of my wife, or I'm looking into the eyes of the person who's interviewing me tonight. I'm here. I'm in my body. That's what
What
that
a
means.
beautiful answer. The only thing better was the question. What is holistic medicine, integrative medicine, and complementary alternative medicine?
Yeah, good question. You know, and we're using lots of different terms and thinking through in terms of what means what. Complementary complements traditional Eastern or Western medicine. Because we live in the Western world, so physicians and nurse practitioners and primary care providers assess and diagnose and utilize the wonders of our medical world to be able to help people. But there are other things they can do, they can refer to. And for example, the notion of pain and suffering in people that have chronic health issues. There are other things that we can do to help them that are complementary, helping them to journal their pain. You know, when people have chronic pain, help them dialogue with the pain. Dear pain, have them write the Dear Pain letter. You know, get in touch in the real moment with that pain that hasn't gone away. I'm just treating somebody with chronic migraines, and she's been to all sorts of special clinics on the East and West Coast, well-known clinics, and still has pain. The last 10 years has pain. But she recently discovered that by practicing mindfulness, in addition to receiving some acupuncture locally, that would be a complementary practice that complements the other things that she's been doing. It's integrative because it's integrating. It's fully aware of that the mind and the body is integrated. We're not just talking about a headache. We're not just talking about a backache or a neck ache. We're talking about a person. And so holism, mind, body, and spirit, are we able to connect that we're not just treating a symptom. This isn't a schizophrenic. This isn't a back pain. This isn't a diabetic. This isn't an obese person. This is a person with obesity. This is a person with schizophrenia. This is a person with a chronic pain issue. We see them as the whole person.
What a wonderful answer. I always teach medical students, the first thing you should say to the patient, unless they fell out of an airplane, is not, where do you hurt? You know what they should say? What's going on in your life? There comes a diagnosis, the correct diagnosis, 90% of the time. What's been going on? And then the symptoms make some sense. Here's a loaded question for you. You'll love this one. Is life a full catastrophe? Catastrophe doesn't mean disaster, does it? This is philosophical approach to life. What do you think, Dr. Johnson?
I think that each and every one of us who live this life will experience pain and suffering. I don't think any of us are immune to it. I think all of us experience realness of our lives. If we're in relationships, we experience the pain of losing those relationships. The elderly might lose lots of loved ones throughout their life. Many of us experience death, divorce, physical, emotional, spiritual pain. So we live the full catastrophe. It's part of who we are. That's a philosophical question. I do like the question. And I do believe that none of us are immune to living the full catastrophe. It's a matter of when, not if. It's a matter of when we experience the tsunami, the flood, the catastrophe, so to speak, in our lives. And when we do, and we will, are we prepared to deal with it in a graceful way? Are we able to deal with it in a way where we have more of our complete sensibility of how to cope with it? Do we have coping mechanisms? Do we have the support systems in place?
A great answer. I think a great answer. Is meditation a passive or active process? And does mindfulness produce a clear mind?
Yes. I think when people practice, and nobody's going to practice anything unless they think they're going to get something from it. You play tennis, yes? You're a good tennis player. I've played with you. I know that you're a good tennis player. And you didn't get that way without practicing. And practice...
I noticed you never came back.
Yeah. But after every technique you taught me, you stopped me on the tennis court and you had me image what you had just taught me. So I would say that meditation is active. I think it's active because we choose to pay attention. We choose to pay attention. And I think it does produce equanimity, a balance of our mind. Yes, a balance of our mind.
Thank you. Thank you. Skepticism and an open mind, criteria for good results for mindfulness teaching.
Skepticism and an open mind. First of all, I think that many of us with any type of issue should be skeptical. I think skeptical is a critical thinking brain. We think, maybe this will work, maybe it won't work. What's the downside? We want people to ask questions. We want them to be fully informed. So I call it a healthy skepticism, I think is an important piece of this process. What was the second part to that?
I'm going to ask you another question. Is yoga meditation?
Yes. Yeah, let me explain that. And people don't actually connect. Because of the type of mindfulness that we teach, we teach that it's not just one thing. We happen to practice it at the Cashman Mind Body Institute in a sitting meditation. Not because sitting meditation is the best way to practice. Some people prefer a laying down meditation. Some people prefer a walking meditation or a running meditation or a eating meditation. Everything we do in our life can become a meditation, so to speak, if we practice it mindfully. So yoga becomes a way for us to increase that sensibility about where we're having tension within the body, because with yoga postures we become aware of the breath, we become aware of how we position ourselves, and the letting go. I don't practice yoga. I have practiced yoga. I think yoga is a wonderful meditative response, but I practice running meditation, whereby I'm very aware in the moment what's taking place within my mind and body. Our spiritual traditions have all sorts of things. Whether we walk on a labyrinth, which is a walking meditation, or we pray using some type of bead, from the Eastern or the Western world, where it's tactile and it helps to connect us. So yeah, all forms of types of meditation that are mindfully done.
I think a great answer. I mean, doing the dishes really can be meditation.
It can
as long as you're paying attention, looking at the dishes, looking at the flowers, looking at the design. It's really a meditation. You can do it. You can do it anywhere. I do it before I operate. I do a meditation and visualization of the operation, and things really will go better. And in this, I think, beautiful conversation we've had tonight, I think we've presenting really a major program to overcome a lot of mind-body illnesses, to reduce stress. And I think this, frankly, should be a great treatment for chronic pain conditions versus for what I'm witnessing in my practice daily, seeing 2 or 3 patients that have had multiple injections of narcotics, and they're just devastated. I saw a patient even today that I turned to the mindfulness away from all these injections and procedures they had done in operations, and it was a girl that had some impairment, and I will admit it was a great day for me. She got up and gave me a hug. Her mother gave me a hug, and the third person that brought them in the first place had seen our programs, gave me a hug. I must say it's been a very great day. And mindfulness can really reduce cancer, heart disease, strokes, many other mind-body illness, can it not? Because they're caused in part by stress. 20% of cancer is due to stress. 20% of cancer is to what we eat. And by developing mindfulness, we can reduce this. We teach these classes at the Cashman Mind Body Institute at Lutheran Hospital. Dr. David Johnson has this seminar on a regular basis, teaches stress reduction and mindfulness for chronic pain and stress. We hope to even expand those. We've had very good positive response to that. We've gotten many patients off their strong medications. Not that we don't believe in some medication, but we tremendously have reduced them. And I really appreciate your help in doing this. And I think in our ongoing series of DVDs that we do, I think we will explain this further. And any closing comments, Dr. Johnson, you would like to make?
I'm looking forward to going home and eating some pork chops.
Don't lock the door. I may be there.
I appreciate being with you this evening, Dr. Cashman.
I really enjoyed it, and I hope our audience enjoyed it. And stop by, see us at the Mind Body Institute, and browse around. I probably have 20 DVDs now, 10 books, all about the mind and the body, connecting the mind to the body. Although I practice full-time neurosurgery, don't get the idea I don't operate. You're making a mistake. I do 200 operations a year. But I fully realize that 50 to 70% of the people that I look at, you and I can treat with mindfulness, stress reduction, exercise, proper eating. And we have DVDs on books, frankly, on all of these things. And of course, it reduces complications, reduces the cost of medical care tremendously. I don't write many prescriptions. I do a lot of teaching. You walk in to see me, you're going to meet a teacher. You know what the word doctor means? Physician means teacher. You come to my office, you're going to be taught from CDs to DVDs to TV appearances to participation in our classes. We did this so people would participate, and we would get them well, which we're doing all over the city. We go into many universities. Now we really appreciate St. Francis allowing us to come in there,
right,
and to teach our classes. The students in the health series are well attended, and I personally think we're having an impact on the community and having a lot of fun. The public response has been tremendous. It has been tremendous. I can walk through shopping centers and people will walk up and say their success. My pain is gone. I lost 30 pounds. My diabetes is gone. And again, Dr. Johnson, thank you so much for in coming here and enjoying this discussion with me. And we'll do this many times in the future.
Great.
Thank you so much. Thank you for listening. Namaste.